My name is Dr. Katelyn Barnes. Before I start, I'd like to acknowledge the Ngunnawal people, who are the traditional custodians of the land from which I'm streaming in from today, and pay respect to the elders of the Ngunnawal Nation, past, present, and emerging. I extend this respect to all Aboriginal and Torres Strait Islander peoples who are joining us today. So my name is Dr. Katelyn Barnes. I'm a research dietitian, and I was invited to speak today as some of the research I've conducted looked into making nutrition guidelines for prostate cancer survivors. I was interested in the area because cancer in general and treatment options, particularly those associated with prostate cancer, can change how people process food. Unfortunately, I didn't find a lot that was conducted in men experiencing prostate cancer. And so instead, we need to draw evidence from other populations who are experiencing similar issues. So today, I'm going to talk about what makes a healthy diet. Is there a protective diet, particularly cancer protective diet, and what would that look like? Diets for weight loss and what foods people should eat. Diets for weight gain and what people might want to eat if they're experiencing malnutrition. And some other dietary patterns and some key features of those dietary patterns that may or may not work. In each section, I'm going to talk about specific foods and offer some simple strategies that could be incorporated every day to improve your nutrition. So what makes a healthy diet? Healthy is a bit of a catch-all term, and a lot of people use it and mean wildly different things. So to me, a healthy diet has a few key features. Firstly, I'd like to refer to the Australian Dietary Guidelines. These are 5 broad statements that kind of encompass what a healthy diet should look like. The most important of which I think are to eat a variety of foods and to choose amounts of nutritious foods and drinks to meet your energy needs. I think these are important because eating a variety of foods will mean that you get a broad range of nutrients in. And of course, choosing nutritious foods and drinks that meet your energy needs will help with weight maintenance and weight loss or weight gain. In addition to these guideline statements, we have specific measures called nutrient reference values that tell us how much of each nutrient we need to function best. These include macronutrients such as carbohydrate, protein, and fats, but also micronutrients, which include minerals and vitamins. So once we had these 2 tools, there was a group of scientists who combined them. So the 5 statements on what a general healthy diet should look like and these nutrient reference values. And they came up with the Australian Guide to Healthy Eating. And this is what it looks like. So this guide has a focus on fruits and vegetables, a moderate focus on whole grains, and a moderate focus on animal foods, including dairy and meats. It also suggests limiting alcohol, fats, and discretionary foods such as chips, lollies, and biscuits. I'm going to step through each of these food groups and talk about specific features of each, and then I'll use this as a guide or a framework to talk about some other specific diets. So first and foremost is fruits and vegetables. These foods should take up the majority of any diet. They provide fiber as well as multiple vitamins and minerals, while also being low in energy or calories. The guidelines recommend 5 servings of vegetables every day and 2 servings of fruit every day. A serve of vegetables could include a cup of salad or raw vegetables such as lettuce, or half a cup of cooked vegetables. For fruits, a serve would be 1 medium-sized piece of fruit like an apple or banana, or 2 of the smaller fruits like apricots or plums. Variety is really important when it comes to fruits and vegetables. All of the different colored and textured vegetables contain different nutrients. So getting a variety of them will make sure that you get a broad spread of nutrients. Aside from quantity and variety, another cool feature is these bioactive compounds that are in fruits and vegetables. We're still learning about these compounds and what they can do, but an example would be lycopene. Lycopene is a bioactive compound that you can find in tomatoes. And it gives tomatoes its bright, reddy, pinky color. But it also has important features for men's health. And there's some research that says it could be protective for prostate cancer. What's really interesting is that lycopene, like other bioactive compounds, when it's isolated and taken out of the food, it seems to lose some of its properties. And that means that we need to eat the whole food to get the good parts of it, really. We don't know if it's the combination of nutrients that occurs in each food, or if it's just helps with absorption having it as part of a whole food. We're not sure. But what we are sure of is that whole foods are better, and they give you more access to these bioactive compounds. The next feature of the Australian Guide to Healthy Eating are grains and cereals, and they should form a major part of a healthy diet. These include foods such as rice, bread, pasta, and even quinoa. Whole grains provide plenty of carbohydrates, which are your body's preferred source of energy, plenty of fiber, B vitamins, and some minerals. To support health, it's recommended up to 5 serves per day, but a serve can be quite small. It's actually 1 slice of bread is a serve, or half a cup of cooked rice is a serve, and a third of a cup of oats is a serve. When looking at grains and cereals, whole grain is ideal. And this is because the outside of the grain, otherwise known as the bran or the germ, is where all of the nutrients actually are. Some processed products like white flour and white bread actually remove the outside of the grain in an attempt to improve color and texture. But in doing so, they take out most nutrients. So when you're looking at your grains and your cereals, aim for whole grain and any products where you can actually see the grains and the different colors of the grains, like browns, yellows, and reds. Dairy and dairy alternatives, such as soy products, are up next. This food group is interesting because it's the only food group where really all of its products are made from one thing, which is milk. Dairy products provide plenty of protein, fats, as well as vitamins and minerals, of which the most important is calcium. To support health, it's recommended 2.5 serves of dairy or dairy alternatives per day. And that 1 serve would be around about 40 grams of cheese, or maybe 2 slices, or about a cup of milk, or maybe 3/4 of a cup of yogurt. If using non-animal sources of dairy, such as soy milk or almond milk, make sure that it's fortified with calcium by checking the label. Calcium is really important for bone strength, and some prostate cancer treatments, such as androgen deprivation therapy, can reduce bone density. To help mitigate that side effect, calcium intake is really important, especially combined with exercise to stimulate that bone growth. Another common question I get around dairy is around low-fat dairy, and if it's as nutritious as its full-fat counterparts. And I can confirm that low-fat options can be good, but do check the sugar content. Sometimes when fat is removed from a product, sugar is added in to try and make it taste better. So check that the sugar content is less than 30%. Meats and meat alternatives should contribute a small portion of daily intake. Meats provide plenty of protein, fats, and some vitamins and minerals, especially vitamin B12, K, A, and E, as well as iron, magnesium, and zinc. A healthy diet includes 2 serves of meat per day, which could be around about 80 grams of cooked chicken, 65 grams of cooked lamb, 100 grams of cooked fish, or 2 large eggs. The non-animal sources of these meat or alternative products can have a bit of a larger serving size. So about 170 grams of tofu is 1 serve, and about a cup of beans is 1 serve. For meats and meat alternatives, less processed is ideal, and low fat is ideal where possible, aiming for the heart smart meats if you can, except for fish. Aim for oily fish at least twice per week, and some of the oily fish include things like sardines, trout, or salmon. Fats and discretionary foods are kind of off to the side of the Australian Guide to Healthy Eating. Now, fats and oils can be an important part of a healthy diet, so don't cut them out completely. Fats are important for skin, for eyes, for your heart health. But when referring to the Australian Guide to Healthy Eating, fats as their own food product are pure fats, so butter, oil, margarine. Whereas fats as part of a health diet can already be found in meats and alternative products, dairy products, and even some fruits and vegetables. So when looking at pure fats, they should be limited and used in small amounts. Aim for plant-based and liquid at room temperature. So olive oils and canola oils are really good for cooking with. Discretionary foods really should be limited. Discretionary foods include foods such as cakes, biscuits, lollies, alcohol, pop chips, And there's a maximum recommendation of 2 servings per day. But again, the serving sizes are quite small. So about 12 hot chips would be 1 serve. 2 small scoops of ice cream, around about 75 grams total, would be 1 serve. And 2 sweet biscuits is a serve as well. These foods don't really add any important nutrients to your diet, but they do add a lot of energy and sugar, which are just empty calories. So that's one of the reasons why they should be limited. Alcohol is considered a discretionary food, but it does have its own guidelines for being part of a healthy lifestyle. The Australian guidelines for alcohol intake are up to 10 standard drinks per week and no more than 4 standard drinks per day. The size of a standard drink changes depending on the alcohol content. Roughly a schooner of light beer is 1 standard drink, but only half a pint of full-strength beer. And there's approximately 100 mils of wine for a standard drink and maybe 30 mils of spirits as well. If you're unsure, always check the label on drinks as well. It can tell you how many standard drinks are in the container that you're drinking from, which is really helpful for things like beers and pre-mixed cocktails, but a little bit less helpful when it comes to wine or spirits when the standard drinks are quite high for the container. One final thing on alcohol is that it contains a lot of calories. So it contributes to your overall energy intake despite not often being considered a food. So it's a bit of a sneaky beverage. Now that we have a baseline of the ingredients for a healthy diet, let's look at some specific types of diets. One that I get often asked about is diets to protect against specific conditions such as cancer, cardiovascular disease, or diabetes. Unfortunately, there's no one diet to rule them all and no one magical food. However, there is a mountain of evidence to suggest there are some protective dietary patterns. The first is associated with a high intake of fruits and vegetables. Whole foods, so no cheating with supplements or juices. We can't exactly say what it is about fruits and vegetables that is protective. It could be all of the different nutrients, it may be the fiber, it could be the bioactive compounds. It's not really clear. But what is clear is that high intakes of fruits and vegetables are associated with lower health risks, including a lower risk of cancer, a lower risk of cardiovascular disease, and a lower risk of diabetes. There's emerging evidence for fiber as a protective factor. So you can find fiber in whole grains, in fruits and vegetables as well. Fiber intake is recommended at around 30 grams per day. And to provide a little context, a medium-sized apple has about 4 grams of fiber, and a slice of bread has somewhere between 3 and 4.5 grams of fiber, depending on the brand and the type of bread. Higher fiber intakes have been associated with lower risks of cardiovascular disease and diabetes, and lower risk of some cancers, as well as more positive mental health. When increasing your fiber intake, water intake also needs to increase to prevent some discomfort and constipation. Other factors that are associated with health protective diets, there's some evidence around reduced meat consumption, particularly associated with a lower cardiovascular disease risk and cancer risk. And it's focused a lot around processed meats such as Devon or salami. However, I should point out that the evidence doesn't say that meats cause health issues, only that people with lower intakes tend to have lower risk over time. So it's an association and not a causation. Some strategies for a health protected diet would be to include at least 1 fruit or vegetable in every meal or snack. You can add berries to cereal for breakfast. You could add grilled tomato if you're having a savory breakfast. Trying to get in a fruit or vegetable in every meal or snack is going to increase the amount of fruits and vegetables you're having every day. Also, going for minimally processed foods whenever possible is going to be helpful as well. That will help increase your fiber intake, but also just to get that whole food in and that range of nutrients that exists in whole foods. Weight gain is a common issue among prostate cancer survivors, particularly those on ADT. Unfortunately, due to changes in metabolism with prostate cancer, weight loss purely through a diet is very hard. So what appears to work best is following a general healthy diet with a focus on low calories and combining it with exercise. When I say low calories, the aim is for about 500 calories or 2,000 kilojoules less than your recommended intake per week. Recommended intake is quite individual. There are some online calculators you might be able to try, but it's probably best to talk with a health professional such as a dietitian or your GP to try calculating out your needs. Now, there's a lot of weight loss diets out there, but some key features of a good weight loss diet should be variety and sustainability. So don't cut out entire food groups. As we went through before, different food groups provide different types of nutrients. And so cutting out an entire food group really requires some careful planning to get everything that you need in. And I think small sustainable changes is really important as well, because if you're making big changes to your diet, eventually it's going to be hard to maintain. So small sustainable changes that are specific to your diet and what you need is going to be a hallmark feature of a successful weight loss diet. Portion control is really important for weight loss diets as well. And it's one way people can cut a lot of calories while still enjoying the foods that you like to eat, just, I guess, eating less of them. So some strategies for weight loss diets include high amounts of fruits and vegetables, including a fruit and vegetable in every meal and snack. And that's because fruits and vegetables are low in calories, but high in fiber, which can help you feel fuller for longer. Other strategies include using a smaller bowl or plate to eat from, and that can help with portion control by making it look like you're not having less food while you actually are. Another option is switching beverages. Switching to non-alcohol or low alcoholic beverages can be really helpful for some people, particularly, as I mentioned before, alcohol contains a lot of calories. Or even if you're a soft drink person, switching to diet options can be an easy way to switch out calories as well. Weight loss can be incredibly individual, and what works for one person may not work for another. So it's best to get support. And it's best to get support by somebody who has appropriate qualifications. So an accredited practicing dietitian is somebody who's trained to help people who have underlying health risks or health conditions to come up with individual ways in which you can adjust your diet while being best and most aligned with your treatment plans. Malnutrition is a form of undernutrition that results in rapid weight loss, not just fat, but also muscle loss. And it can occur for multiple reasons, a change in the ability to absorb or process foods, or even changes in your ability to eat foods, like feeling unwell or losing your taste or losing your appetite. Malnutrition is a serious health issue and can have far-reaching impacts on the body, and it can even reduce the effectiveness of some of the cancer treatments. It requires a diagnosis and it requires support from health professionals to overcome. And that's really where an accredited practicing dietitian is needed. They're specifically trained to assess and treat malnutrition, working with you and your loved ones and your treating teams to come up with the most appropriate treatment plans. Generally speaking, for malnutrition and weight gain, the focus is on getting bang for your buck. So calorie-dense foods and high-protein intakes to maintain your muscles. Pretty much the opposite of everything I've just been talking about. And then the strategies focus around appetite and working with your appetite to be able to get in as much food as you can. These will all be quite personal, which is why it's really important to work with an accredited health professional to design a plan that's going to work with you. Some other dietary patterns that you might have heard about would be the Mediterranean diet or the DASH diet. Both of these have a focus on fruits, vegetables, and whole grains, which I think is fantastic because that's where we have the most evidence for supporting health. The Mediterranean diet is a little bit different in that it has a focus on fish and seafood. And you can see in the pyramid there that fish and seafood is in the middle and all your other meats are pushed towards the top, and they're saying to eat those in smaller amounts. The Mediterranean diet also has a focus on physical activity, and it mentions wine in moderation. The DASH diet is actually very similar to the Australian Guide to Healthy Eating. There's a big focus on fresh fruits and vegetables, a big focus on whole grains, but they do actually specify low-fat dairy and low-salt options as well. Something that you might have heard about coming up more popularly lately is the high-fat and low-carb diets. There is some moderate evidence to support weight loss using a high-fat, low-carb diet in the short to mid-term. But long-term, the diets don't seem to be very sustainable. And as people transition out of them, they tend to regain quite a bit of weight. The other thing with the high-fat, low-carb diets is that they don't have the same emphasis on fruits, vegetables, and whole grains, which is where most of the evidence lies for health protection, weight loss, and general health. So I think sticking with a diet that has a focus on fruits and vegetables and a focus on whole grains and whole foods and a variety of foods, that's where the key will be. I'm going to end on this slide because it's the perfect screenshot opportunity to get most of the information I've just presented. And while you do that, I'm going to cover some key messages that I hope you all take away from this presentation. Firstly, is that variety of food is very important. You can get different nutrients from different food groups and different nutrients within food groups. So getting in as many different types of food as you can is going to support your nutrient intake. There should be a focus on fruits and vegetables. Remember to get in your 2 fruits and 5 veggies every day. Portion control is really important, and you should try and stick within the recommended serve sizes from the Australian Guide to Healthy Eating. It's very easy to go over. And finally, do engage an accredited practicing dietitian to support your journey if you need. You can ask your GP or your treating team for a referral to a dietitian, or you can check out the Dietitian Australia's website. They have a Find an APD webpage, which is linked at the bottom of the slide. Also linked is the Eat for Health website, where you can find much more detail on the Australian Guide to Healthy Eating and even some example meal plans. Thank you so much for having me. I hope this has answered some of your diet-related questions, and I hope you enjoy the rest of the conference. Thank you.